Today, I want to start with a question that I get asked constantly in my clinical practice, in my DMs, in consultations with people who have just come out of a gynecological appointment holding an ultrasound report. The question is, why do fibroids grow? And I want to give you a real answer, not a simple answer, because the honest truth is that fibroids are not a simple condition. They are the structural expression of multiple possible patterns. Patterns that can involve cold, heat, dampness, stagnation, deficiency, hormonal disruption, environmental burden, and genetics. Sometimes one pattern dominates, often several are present. What I see consistently in clinical practice is that when we treat a fibroid patient without fully mapping their individual pattern, when we assume that it's always blood stasis or always cold or always the same presentation, we get incomplete results. We may slow the growth, we may reduce symptoms, but we don't shift the terrain. And shifting the terrain is the whole point. Hey everyone, welcome back to the channel. If you're new here, I'm Megan and I help women navigate their fertility journey using traditional Chinese medicine and holistic health practices. If you've been following along and find this information helpful, please like and comment. This work is very meaningful to me and the people I support who wish they knew about this framework of medicine long before their diagnosis. Today, I'm going to walk you through all of the major TCM patterns involved in fibroid development and growth, how food, the environment, and genetics each play a role, what fibroid size means for your treatment approach, and with a clinical story, what becomes possible when we get the pattern right. Why do fibroids grow? The 6 TCM patterns. Let me take you through the 6 TCM patterns most relevant to fibroid development and growth. In clinical practice, I almost never see just one of these in isolation. The art is identifying which patterns are primary, which are secondary, and how are they interacting in this specific patient. Pattern 1, cold stagnation and blood stasis. Cold is one of the most common and most under-addressed root patterns in fibroid cases. When cold accumulates in the uterus through diet, environment, or constitutional tendency, it slows the movement of blood. Slowed blood congeals. Congealed blood accumulates over time into what TCM calls a blood stasis mass and what Western medicine calls fibroids. The clinical picture of a cold blood stasis fibroid patient typically includes dark, clotted menstrual blood, sharp stabbing pain that responds to heat, cold extremities, fatigue, and a history of dietary cold exposure, iced drinks, cold smoothies, raw food diets. This patient needs warming before anything else. Moving blood aggressively in a cold, depleted patient will exhaust them further and fail to prevent reoccurrence. Supporting the underlying issue of cold stagnation with a warm diet. Warming the terrain first, moving blood comes after. This sequencing is everything. Pattern 2, heat toxins. This pattern is less discussed, but it's clinically significant and I want to give it proper attention today. In TCM, chronic heat in the blood and the reproductive tissue creates an environment that is highly conducive to the proliferation of abnormal tissue. Heat accelerates growth. Heat drives inflammation, and heat toxins, the deeper, more pathogenic form of heat, creates a kind of sustained, damaging inflammatory environment that both initiates fibroid growth and fuels it over time. The clinical picture here is different from the cold pattern. This patient may have heavier, brighter red bleeding, sometimes flooding. They may have a sensation of heat in the lower abdomen. They may also experience premenstrual breast tenderness, irritability, flushing, and maybe spotting. Their tongue is typically red with a yellow coating, and the pulse will feel very fast. And critically, their diet and lifestyle often reflects the heat pattern. Excess red meat, alcohol, coffee, sugar, spicy foods are chronic inflammatory diet inputs and can directly contribute to heat accumulation in the blood. This matters enormously for treatment. A patient with a heat pattern and a fibroid that is driven by heat toxin doesn't need warming herbs. They need heat clearing herbs, blood cooling, and a significant dietary shift. This is why assuming all fibroid patients having a cold pattern and prescribing warm formulas universally is a clinical error. Pattern identification is not an option. It's the entire foundation in TCM. Pattern 3. Damp-Phlegm accumulation. Fibroids are structural accumulations, and accumulations in TCM are understood as tangible phlegm. Damp-Phlegm develops when the spleen's capacity to transform and transport fluids is impaired. The result is a sticky, heavy, obstructive pathogen that settles in the die, or the belt vessel, where reproductive organs are housed. Phlegm damp impairs circulation and over time consolidates into the kind of discrete masses we see on imaging. The damp-phlegm fibroid patient tends to present with bloating, heaviness in the lower abdomen, a sensation of fullness, fatigue, and often a history of digestive sluggishness. They may also carry excess weight and have irregular periods, with mucousy or pale discharge. Dietary contributors to damp-phlegm are significant. Dairy, sugar, refined carbohydrates, and excessive cold or raw food all burden the spleen and generate dampness. This is constitution dependent. Not every woman who eats dairy will develop damp-phlegm, but for women already carrying a spleen deficiency pattern, these foods actively compound the problem. Pattern 4. Liver qi stagnation. The liver governs the smooth flow of qi throughout the entire body. When liver qi stagnates through chronic stress, emotional constraint, suppressed frustration or anger, or the relentless overfunctioning that many of the women I see have built their lives around, the ripple effects on the reproductive system are profound. Liver qi stagnation impairs the smooth movement of blood. Over time, stagnant qi produces stagnant blood, and stagnant blood in the uterine environment contributes directly to fibroid development. It also makes existing fibroids larger and more symptomatic because obstructed terrain amplifies everything. This pattern is why stress management is not a soft suggestion for fibroid patients. It is a clinical priority. The liver must be able to move. When it can't, the entire reproductive system pays the price. Pattern 5. Kidney deficiency. The kidneys are the constitutional root, the source of Jing, the deep essence that governs reproductive capacity, hormonal regulation, and long-term vitality of the uterus and ovaries. When kidney energy is deficient through overwork, chronic illness, constitutional inheritance, or the depletion of years unaddressed stress and dysmenorrhea, the Chong and Ren vessels lose their proper nourishment and regulation. Kidney deficiency creates the kind of terrain in which pathogenic factors accumulate without adequate counterforce. A body with strong kidney energy has the constitutional vitality to clear, circulate, and maintain healthy tissue. A body with a kidney deficiency is less able to prevent the accumulation of damp, phlegm, and blood stasis, and more likely to allow them to solidify into structural changes. Genetics also enter the picture here. Kidney Jing carries our constitutional inheritance, and there's often a family history of fibroids, endometriosis, or reproductive conditions in women with significant kidney deficiency patterns. This doesn't make the outcome inevitable, but it does mean the terrain requires more deliberate, sustained support. Pattern 6. Chong and Ren disharmony. The Chong vessel, the sea of blood, and the Ren vessel, the sea of yin, together govern the deepest layer of reproductive function, uterine health, and menstrual regulation. When these extraordinary vessels are disharmonious through any combination of the patterns above, the uterus loses its capacity for healthy, rhythmic, self-regulating function. Chong and Ren disharmony is not a pattern you treat directly in isolation. It's the expression of accumulated imbalances from the other patterns, but naming it matters. It tells us we are looking at a deep, constitutional, long-standing disruption that requires sustained treatment rather than a short protocol. It also reminds us that fibroids in many cases are not a recent development. They are the structural expression of a pattern that has been building quietly for years. The pattern is rarely just one thing. Here's what I want you to take from this section. Fibroids are not one pattern condition. In my clinical experience, most fibroid patients present with 2, 3, even 4 of these patterns simultaneously. A woman may have cold stasis as her primary pattern and damp phlegm as a secondary one. Another may have heat toxins, driving the proliferation alongside liver qi stagnation from years of chronic stress. A third may have kidney deficiency as the constitutional foundation with blood stasis accumulated on top. The pattern picture determines the treatment, and this is precisely why a personalized, thorough assessment is not a luxury. It is the minimum required to treat fibroids effectively. Food, environment, and genetics. Now let's talk about the 3 major external and constitutional factors that interact with these patterns, because understanding the patterns is one thing, understanding what drives and sustains them is where the practical power lives. Food, the most immediate lever. Diet is one of the most direct and modifiable inputs into the fibroid terrain. But the conversation has to be nuanced because the right dietary approach depends entirely on the pattern. For cold stagnation patterns, the priority is warmth. Cooked foods, warming spices, ginger, cinnamon, turmeric, warm beverages, and a reduction of cold and raw inputs. Iced drinks, cold smoothies, and excessive raw foods are direct contributors to this pattern and need to be significantly reduced. For heat toxin and liver qi stagnation patterns, the dietary picture is different. Red meat, particularly processed and conventionally raised, generates heat in the blood and contributes to the inflammatory heat excess picture. Alcohol, a direct liver toxin that generates heat, impairs liver qi movement, and burdens detoxification. Coffee, in excess, agitates the liver and generates heat. Sugar and refined carbohydrates drive inflammation and contribute to damp-phlegm accumulation. Dairy, especially full-fat conventional dairy, is one of the most significant damp-generating foods in the diet. I want to be clear, I'm not telling every fibroid patient to eliminate all of these foods. Constitution matters, pattern matters, and a person with a cold pattern and mild heat signs is going to have a very different dietary prescription than someone with a dominant heat and damp picture. But I'm saying that if you have a fibroid diagnosis and you're regularly consuming large amounts of alcohol, excess red meat, sugar, dairy, and coffee, it's worth having an honest conversation about how those inputs are interacting with your terrain. The question I always ask is this food building the environment I want, or is it feeding the environment I'm trying to change? Environment, the invisible burden. Environmental factors are increasingly recognized in fibroid literature, and they map clearly onto TCM's understanding of external pathogenic influences that burden the liver and accumulate in the reproductive tissue. Xenoestrogens, found in plastics, conventional personal care products, pesticide residues, synthetic fragrances, and food packaging, mimic estrogen in the body and directly stimulate fibroid growth. They also burden the liver's detoxification pathways, which impairs the liver's ability to clear excess estrogens and maintain the smooth qi flow that prevents stagnation. Reducing environmental exposure is not about perfection. It's about reducing the total burden on a system that is already dealing with internal pathogenic factors. Switching to glass or stainless steel where possible, choosing cleaner personal care products, reducing plastic food contact, and prioritizing organic produce when available. These are incremental reductions that accumulate meaningfully over time. Genetics. The constitutional foundation. Genetics is the layer we can't change, but we can absolutely work with it. A family history of fibroids, endometriosis, and uterine conditions tells us that the constitutional terrain, the kidney gene, the strength of the Chong and Ren, carries a vulnerability that requires more deliberate, sustained support. This is not a sentence. This is information. And a person with a strong genetic predisposition to fibroids, who addresses their terrain early, who supports their kidney energy, manages stress load, eats in alignment with their pattern, reduces their environmental burden, and monitors cycles as a vital sign, has a fundamentally different trajectory than one who doesn't. Genetics writes the blueprint. Terrain decides what gets built. And terrain is always workable. Fibroid size matters when TCM alone is not enough. I want to spend a moment here being very direct because I think clarity on this point serves you far better than false hope. TCM is a powerful tool for fibroids. It can reduce symptoms, slow or halt the growth, address the terrain that drives proliferation, and in many cases, particularly with smaller fibroids in the right patient, produces remarkable results. And I've seen this in my practice. But fibroid size matters enormously for prognosis. And I think it's important to be honest about what that means clinically. As a general clinical guideline, fibroids under 4 centimeters are the most responsive to TCM treatment alone. In these cases, a well-designed protocol that addresses the underlying pattern combined with dietary and lifestyle support can produce meaningful reduction in size, symptom relief, and improved fertility outcomes. Fibroids larger than 4 centimeters presents a more complex picture. At this size, the structural burden on the uterus is significant, and TCM treatment alone is unlikely to reduce the fibroid to a clinically manageable size within a reasonable time frame. For people in this category, especially those who are trying to conceive, I strongly recommend a conversation with your gynecologist about surgical intervention, myomectomy, or other appropriate options, alongside with their TCM care. This is not a failure. This is integrative medicine working as it should. Surgery addresses the structural burden that TCM can't efficiently resolve at that size. TCM before and after surgery addresses the terrain that created the fibroid in the first place. Because here's what surgery alone doesn't do. It removes the fibroid, it doesn't change the terrain. And the terrain that grew one fibroid without intervention will grow another. Recurrence rates after myomectomy without addressing the underlying pattern are significant. This is where TCM's most important contribution often lies, not in shrinking the fibroid, but ensuring it doesn't come back. The terrain is always the work, whether we're working before the surgery or after, or with a small fibroid where surgery is not yet indicated. The terrain is always the work. Clinical story. Let me bring this to life with a clinical picture that illustrates how pattern identification changes the treatment approach entirely. I've seen patients with fibroid diagnosis who came in presenting with what appeared on the surface to be a straightforward blood stasis case. Dark clots, cramping, some cold signs, but when I looked more carefully at the full picture, the diet, the lifestyle and emotional history, the tongue, and the pulse, I found a more complex layering. Cold stagnation as the foundation, yes, but also significant heat signs from years of high coffee and alcohol intake and a dominant liver cheese stagnation pattern driven by chronic professional stress and a spleen deficiency generating Damp-Phlegm. This patient needed a sequenced, multi-pattern approach, not warming alone, not blood moving alone. We had to address the heat, support the spleen, calm the liver, and warm the foundation, all in the right order and at the right times in her cycle. We worked on a warming diet, addressing the cold stagnation layer, while simultaneously reducing the heat-generating inputs. Alcohol was reduced significantly, coffee pulled back, red meat reduced and replaced with more plant-based protein, warming animal foods like bone broth. Liver support herbs were introduced alongside spleen tonics. Once their constitution had changed and the competing patterns had been addressed, we introduced Xiaofu Zuyu Tong to move the blood stasis directly. Finally, the use of Xiaofu Zuyu Tong when their constitutional deficiencies were addressed. The fibroid didn't disappear, but it stopped growing. The symptoms improved substantially, and their cycle became less painful, less heavy, and the terrain that had been driving the fibroid's growth, that layered combination of cold, heat, dampness, had genuinely shifted. That's the goal, not a magic fix, a terrain shift. From a shifted terrain, very different things become possible. Here's what I want you to take from today. Fibroids are not a single pattern condition. They grow because of cold or heat or dampness or stagnation or deficiency or a combination of all of these, shaped by your food, your environment, and your constitutional inheritance. Understanding which patterns are driving your fibroids is not a detail. It's the entire clinical picture. Size matters. If your fibroid is over 4 centimeters, please have a conversation with your gynecologist about surgical options. TCM and surgery are not opposites. They are complementary. Surgery manages the structure. TCM shifts the terrain. Together, they give you the best possible outcome and the lowest possible risk of recurrence. And regardless of where you are, small fibroid, large fibroid, pre-surgery, post-surgery, actively trying to conceive, the terrain work is always available to you. There is always something we can do to make the environment less hospitable to fibroid growth and more hospitable to the life you're trying to create. Given how central liver qi stagnation and chronic stress are to the fibroid picture, and how consistently I see this pattern in my fibroid patients, the resource I want to point you to first is the Stress-Free Goddess program. This is designed to address exactly the depleting, contracting, stagnation-generating effects of chronic stress on your reproductive terrain. If you know that stress is part of your picture, and if you're honest with yourself, it probably is, this is where I would start. The link is below. If you're ready to support your terrain by reducing your environmental exposure to toxins, the Optimal Fertility Blueprint is where we do that work. And for everything else, free resources, more videos, the full range of programs, you can explore that at mktcm.com. Until the next video, be curious, be informed, and be vibrant. Thanks for joining me.